I'm Carly Kramer. I'm the founder of Beekeepers Naturals, and this is the science of fertility. Let's get into it. So you were my lifeline during my pregnancy, before my pregnancy, during preconception, postpartum. You have been such a resource and a guide for me in my life. And not everyone has a BFF who specializes in fertility and women's health. Right. And you are my physician. You are also my very dear friend.
Yes.
And you've helped me so much. And so I really wanted to create this podcast because it can be really challenging to know what to do to get ready, support your fertility, what to do while you're pregnant, what to do after.
Totally.
And who better to hear from than a doctor who specializes in this space and has guided so many women through their fertility journeys. Not just that, but a doctor who is trying to get pregnant herself. You are just starting your fertility journey. You are in it. You have a pretty incredible story and background and life circumstances that brought you into this world.
Right.
And I think people want to know what you're doing.
I think you're right. Yeah. And to be totally honest, I was a little anxious for today. I've been holding the weight of this story in a way that I know I don't need to. And I think part of that is just from my own perception of what society puts on us as women in regards to fertility. When we think about fertility, I think most of us just think about the woman instinctively. And like that's where our mindset goes and what we focus on. And so when I went through my own journey and was met with a call that I'll never forget, where the doctor told me, you are infertile. In my early 20s, I had no idea what I was doing or how I was going to come back from that. And that really is what launched me into what I'm doing today and the beautiful part of what I got to do with you and helping you make such a beautiful baby girl. I feel ready to share today and to hopefully shed some guilt and some shame in the process. So we're both from Canada. We love Canada. Shout out to any Canadians. Back home, I was in college. I was in my early 20s. I woke up one morning, and as cliche and as cheesy as this sounds, it's as honest as I can be. I just woke up and I was like, I'm going to sign up to donate my eggs.
Everyone needs to know in Canada, you do not get paid for donating your eggs. So Melissa is just a genuine angel who at 21 years old had the maturity and emotional capacity to think about helping others that can't conceive. And it was just something out of the goodness of your heart you wanted to do, which is mind-blowing.
Thank you.
Says a lot about you.
Well, thank you. It truly is just this wave that came over me of like, this is something I'm meant to do. And I think looking back on it now, I was, because look at where we are today. But regardless, I just woke up that morning, I'm going to do this. So I hopped on, found a few different companies that go through the process, found one that I aligned with, signed up with it, created my profile, all of that good stuff. Some time passed. I want to say it was like 6 or 9 months that had passed before I had heard anything. You generally get a call if you get a match. I got a call. It was on a random weekday, just finished working out, and they were like, we have a match for you. We have this amazing same-sex couple from back home in Calgary. I was living in Vancouver at the time for my undergrad. And they're going to come out, we're going to get the testing done and get things going. And I was so excited. I didn't think much about it since time had passed. And then when it came up, I was like, oh yeah, this is going to be such a beautiful process to be a part of. And then once they had come into town, I got to meet them, which was amazing. They were so grateful for me, and I was just grateful for them and the opportunity. And what was funny, and as you know me, I love being slightly humorous and sarcastic. So in my profile, my reason for donating was, well, they're just getting wasted every month anyways. Like, I have extra to give. Why wouldn't I? And they loved that. So they chose me. Beautiful, amazing. And so we went through the process of getting some blood work done. The clinic that I use, they have you sit down with a psychiatrist, which I thought was really amazing. They want it to be a really intentional process of asking tough questions and things I hadn't thought of. Like, hey, when the kid turns 4 or 5, they generally start asking questions about like where they came from, especially if they see that they have 2 dads and those sorts of things, and things I just wasn't thinking of, but I loved having someone to work through that process.
I love that they ask you that in the process.
Absolutely.
Because these are foundational things that, you need to think about when you're going through that process. Yeah.
And they were also like, hey, if we get X number of eggs and they only use this amount, what would you like done with the rest? Are you open to donating again? Like, again, just things I hadn't thought of. And I was like, well, yeah, amazing. Why not? So anyways, it was just a good, holistic, wholesome process. I remember going through with the blood work. There was something about the blood work they didn't love. Initially, I was left in the dark. They didn't say much. They were just like, hey, we need you to come back. We have to do a few additional tests. I didn't think much of it. It was a pretty quick turnaround. I went back in. I had an ultrasound done. It was a transvaginal ultrasound, so they inserted a probe vaginally. And what I now know, they were looking for what's called an antral follicle count. So just looking for how many eggs were developing on each ovary. Then another day or two passes, again, kind of left in the dark. And then this is when the phone call comes. So it was in the summer. I think I had just turned 22 at this point. I was in summer school trying to get ahead in a few classes. And I get the call, and it's immediately the doctor, which most of us, unlike our experience, we don't love getting calls from our doctors. It's not always good news. So I answer the phone, and it was such a blur to me. The things that stood out were truly them saying, we're sorry to tell you, you can't donate eggs. You have signs of premature ovarian failure. You yourself are likely infertile, and you will likely need an egg donor yourself if you want to ever conceive and have children in the future.
That's so much at 21. And, of course, you were not a physician at this point.
No.
So you're just...
It was like all over my head, and it was just a dump of insanity and so many emotions, so much to process. And the only thing that I held on to was just them saying, you are likely infertile.
Yeah.
And I was 22. And my whole hope was I have this abundance of fertility, and I'm trying to, share.
Was there any medical history in your family? Has anyone else struggled to conceive? Were there any things?
Like any signs?
Any signs?
Yeah. My mom did not have any difficulties. Neither did my maternal grandmother. My paternal grandmother did have some difficulties. She was told that she likely wouldn't have children, and then had 7.
So no difficulties.
So no difficulties.
Yeah.
And so to be met with that, it was like, oh my goodness. Yeah. And at this time point, my parents knew a little bit about what I was doing. And I just remember like calling my mom, like bawling, like I'm struggling to process, like, what do I do now?
Yeah.
And so when I was on the call, the 2 offers that they gave me was, we can try and do an egg freezing cycle now if you want to try and preserve some aspect of fertility that you have, because it's better in our younger years.
Yeah.
Or you can just watch and wait.
Yeah.
And they're like, and you'll likely go through early menopause. Good luck.
So brutal.
And I can only imagine how women feel now, because I have so many patients that come in that are like, I felt dismissed. I didn't feel heard. There were so many questions that went through my head, and it's exactly how I felt.
Well, that's also why you are who you are as a physician. So myself included, all your patients are so lucky. And most of your patients, I think probably all of them other than me, don't know this story. And how deeply their stories and their challenges resonate. And we're just very lucky that you chose the career that you did, and that you can be there to support. And we'll get into my story next episode, but we all know you can be met with so much shame and so much self-judgment and fear. And even when you're trying and it doesn't happen right away, just, at least for me with my anxiety, you go right to what's wrong. So how did you handle all of that at 22?
Initially, it was honestly a deep amount of sadness and a feeling of loss for a life I thought I would have.
Yeah.
I didn't realize or really think much of how much I wanted to be a mom until I received a call that said, hey, you may never be a mom in the way you'd always envisioned. It may look different for you. Yeah. And that was like such a hard standstill. And at the time I was in a relationship. It's not my husband now, but we weren't at that point. And so it was just so much. And so that period of sadness was honestly felt like mourning of this life and this fertility felt that I had that I didn't. And then it transitioned, and I think for a lot of us again, into this like hyperfixation of like, no one's giving me answers, I will find them. And that's really what drove me into naturopathic medicine of just, there has to be another approach. There has to be something else that was missed. What is something else I can look at? What are all these tests I can do? It was just like this endless, sleepless nights of like, I want and need to find the answer to why this happened.
And it's so wild. This is such a foundational, life-shifting thing, and to not have answers and to have all of this be relayed to you in a quick phone call
and just dumped on you.
Yeah.
I think the tough part about like sitting with you here today is I still don't have those answers. Yeah. And that's frustrating. That's been tough for me. I can feel myself getting emotional as I say that. It's been a lot because I've spent so many hours looking into the why. And I can't find it. And I love what I've been able to do and the whys I've found for others, but for mine to remain a mystery has been really difficult.
Yeah.
I think that's part of why I've been hesitant to share, because it feels like I'm the patient that I haven't found the answer for yet. And if I haven't for myself, am I gonna, fail at someone else? Yeah. And that can, just be this endless snowball effect. But because of that, I think it's also allowed me to be the provider that like will dig deep, as you know, and as we'll talk about in future episodes.
You called something out with my journey that nobody found. So we'll talk about that later.
And the extensive blood work, like the extents I'm willing to go to help them find their why. Because there's so much peace with that. And I think I'm waiting to find that peace. And I don't feel settled with it. I don't feel like the book is closed. The journey's not closed. As you said, my husband and I are currently trying. And I'm so excited for that.
Well, that's the most beautiful part, that, you don't need to have the why to move forward.
Right.
And even with all of this, you have been a part of creating so many miracles. You have had so many patients that by other providers or in other settings were told that it's not going to happen, and you've helped them create something beautiful. And so you and your partner are now starting this journey to create something beautiful. And you know better than anyone that whether you're considered infertile or not, it doesn't actually mean it's not a sentence. So maybe let's talk about that for a second, because people hear that and it feels like a sentence.
It totally does. It feels like a full stop. And now we are noticing more and more couples are struggling with this umbrella term of infertility, which I really try and shy away from using in practice, to be totally honest, because from my perspective, I just think there's rocks uncovered. Like there's journeys and paths we haven't gone down. I don't feel like it's this full stop. We say it used to be 1 in 8. We're closer to 1 in 6 couples now. And we know that roughly 40% of the time it's female factor, 40% of the time it's male factor, which they'll get their own episode on.
Oh yeah, we need to do a whole episode on the male part.
Yes, men, hear that? 40%. Send this to your men right now. 40%.
Yeah.
And then there's this 20% that could be a combo, or that they say unknown infertility, which I hate that part. But regardless, that sits there. And so yes, I think it's overused, and I think we have more answers now. And what's frustrating for me as I've grown more in clinical practice is the reason for the infertility was something all along that just wasn't looked at. And I mean, that's been, our experience working together too. It's just something that wasn't.
Something that was missed.
Right, exactly. So my husband and I are on our journey now. which has been exciting. Well, really, it started.
You're just starting the journey.
Yes,
Yeah,
we're starting the journey.
But it started a while ago
Yes.
because Dr. Clark starts 3 months before.
Absolute minimum. We really started 6 months prior. But 3 months prior was like really when we like honed in on our routine. And so for both of us, initially it was just like these full, complete blood work panels, which I know we'll get into detail on in future episodes too, of like what that could
What to look for, what to ask.
and what it should look like.
I just want to reiterate that for everyone listening because people don't realize. I know initially I assumed like, oh yeah, you just get pregnant. Like I've been trying to not get pregnant my whole life, so now it's just going to happen. But there is so much you can do in the preconception phase.
Totally.
Independent of gender to help support the process. And so at minimum, you start getting people ready at 3 months, ideally 6 months.
Right.
So why don't we talk about that right now? What are, starting from sort of least invasive, most accessible, so starting with blood work to see where everything's at. What have you been doing to get your body ready for pregnancy?
Okay, amazing. I love that. And I want to just precursor this. This is what I've been doing based on my blood work and what works for me. So please, everyone, chat with their docs before venturing. But also bring these as questions to your provider. If this is something and something I say resonates with you and your story and you're not getting those answers, like please ask the questions. So all that to say, yes, the blood work was like a initial standpoint of, okay, where is everything sitting right now? So that panel really helped guide next steps. So in regards to like, okay, cholesterol was slightly elevated. Okay, what am I doing dietary wise that could improve? So all that to say that helped kind of guide the diet and nutrition piece was really blood work wise. And dietary wise, there's a lot of noise out there and I want to recognize that. And a lot of what I do with my patients and that we'll do is digesting the information that's out there because there can be some really strong and opposing views. And I think there's merit to both sides. I think it's important that we find something in the middle that resonates with that individual and fits in their life because the importance is really the sustainability of what you're eating and feeding your body every day.
You've always been a big advocate of a balanced diet, heavier on the protein.
Yes. And protein's the hill I'll die on. Every day of the week.
And when you're, especially for fertility, I mean, actually, you stopped me from it. You were like, stop the intermittent fasting, none of that.
Yes.
So that's a big one too.
Totally.
So,
we need a fed state for our body to prepare for pregnancy. And a lot of that has to do with intermittent fasting, wonderful benefits to it. Absolutely. Different time and place in our lives than the fertile window and just preconception care. And the main reason is when we're fasted, our body recognizes a strong caloric deficit and our hormone regulation and production shifts in response to that hormone deficit. And we need to be in a fed state. So girls, eat the meals. Get the protein in before your coffee. Ideally, please don't go coffee first. Protein, we love protein. Generally, at a minimum, 100 grams per day is a good target. Everyone's a little bit different, but that's my like absolute lowest target for myself.
So starting with least invasive, you're doing heavy protein, always eating breakfast. I see the way you eat. You eat a pretty balanced diet.
Yes,
you know,
and I'm not perfect.
No,
I will.
You're not
I
perfect,
do enjoy French fries. That's very important for everyone to understand. I am not on my high horse.
We've had many
Sour
meals
Patch Kids in the past. Yes, do not hate me for that.
It's like an 80-20 thing.
Yes, absolutely.
So that's starting with least invasive.
Yep.
And then exercise, because you also got me weight training. I was not a weight training gym girly, and I have had like a huge transformation here.
Yes.
And you started me with this in my preconception period. I did it all through my pregnancy. So tell us about where you're at with that.
Yes. So weight training for
why?
me, yes, the weight training for me at a minimum is 4 days a week, generally closer to 5 with a mix of endurance, like cardio training, which can differ to like incline walking. My goal is to really be in a zone 2. There's different heart rate zones. Those zones, while not perfect to just use heart rate, but helpful, those zones really just differ in our ability to utilize different things for fuel. So zone 2 allows us to break down and use what's called beta oxidation of fatty acids. So we're getting in enough oxygen that we can burn fat as fuel. That can be helpful for that more endurance type training.
Love a little incline on the treadmill.
We love a little incline. Girls, it works. A little 10, 12%. 3,
Ooh,
3.5.
10, 12.
Oh, where are you? I'm worried. Are you at a 5?
No.
Oh, no.
Let's not talk about
Yeah,
it.
okay. Moving on.
I'm doing there is an incline.
Oh, good. I would argue if we're at or under 5, not much of an
We need to go
incline.
up. Okay.
But you hike.
I hike.
I'll give you that.
That's true.
I'll give you that. So there's that piece, running. And the weight training, and the biggest reason for exercising our muscle groups is, well, exercising them and doing resistance training is the best way to build them. What our body does is when you lift those things, you cause micro tears and damage to the muscles, which then trains our body to build those back stronger and thicker, for a lack of a better word. And so in doing that and having more muscle mass on our body does a few things. One, super important for me personally, is our muscles can act like sponges for glucose. With our muscles being more active, we can actually get non-insulin dependent glucose uptake. A fancy way of saying our muscles can absorb the sugar from our bloodstream without relying on insulin. So it can be really helpful for people who are insulin resistant, just meaning their cells ignore that insulin signal. And so having more muscle mass can be extremely helpful, especially for patients with polycystic ovarian syndrome. And or just anyone wanting to improve their metabolic health. That's also why things like walking after meals is beneficial, those small things. And the other thing that our muscle does is it releases something called myokines. It is kind of like a hormone, or a way in which our muscles interact with our other female hormones. So thinking of things like estrogen, testosterone, that whole area and cycle within our system. So
having muscle mass as a woman actually helps to regulate your hormones.
it does. Because for
so long we were like, don't get big. It's not for women.
Right.
Yeah.
And I appreciate all those that may be listening or watching that are like through and through Pilates. And not that I hate Pilates, but we generally need to lift more weights to get a little bit more muscle mass on us.
Like just how I feel going from a Pilates yoga only to weightlifting. I'm not doing heavy cardio, but I do I hike and I'm doing my like incline walking.
Great.
Game changer. But so that's huge for balancing hormones. And, you know, on the fertility journey, we need this.
Yes, super helpful. Yeah, the exercise, weight training, and the high protein are like the hills I'll die on.
Yeah.
And then moving forward from that, for us, something that's kind of on the docket as a next step, if needed, is actually doing intra-ovarian PRP, or platelet-rich plasma, which I think is really cool and exciting.
Yeah, that's very
I think people are
edge.
becoming more and more aware of PRP, platelet-rich plasma. We're getting your blood drawn, we're spinning it down, separating the red blood cells from the platelets, the plasma part, the liquid part, and then condensing that down. The platelets are really rich in growth factors and can be used for different things like facials.
Yeah,
I think
I've
we've
injected
both
that
enjoyed.
into my face, and then also
Under
spinal
eyes,
injury.
Yes.
Your husband injected that into my spine.
Yes, you and me both. And our backs are doing better. So that's a sidebar.
It really works.
Yes, which is great. So the intra-ovarian PRP, again, smaller studies, but research coming out that it's also something that can be useful for premature ovarian failure. And what the platelets are doing when injected is they're kind of acting as like recruiting agents. And so they're there to have their own growth factors, but also signal to the immune cells and the immune system like, hey, there's some damage, inflammation here that you need to come take care of, need to come and support. And by doing so directly into the ovaries, we can just get some more benefit from that. So again, something that's newer. I'm hoping there'll be more research on it. There's a few clinics in the States that are doing it. It's certainly not ubiquitous, not widespread, but I'm hoping that will expand.
Would that be like a vaginal inject? Like how would you do that?
Yeah.
Okay.
So similar to how they kind of do an egg freezing cycle where we're kind of puncturing through that vaginal wall. That's how it's recruited, and that they're injected rather, So that's the process of doing the intra-ovarian PRP. And then in a similar fashion, we actually can do intrauterine PRP. And there's some research showing that that can be beneficial prior to an embryo transfer, for example, can help with implantation rates. So that's really neat. I was once told that the uterus is kind of like a war zone for sperm when they enter because our immune system recognizes it as foreign. And that's why we need such a large quantity of sperm to get pregnant. They have like tens to hundreds of million within like one ejaculate, like how many milliliters of that, and yet one makes it, obviously. So just to show that like our immune system can attack it, and so that intrauterine PRP can be really beneficial also. So that'll kind of be next steps. And I think something that I don't know that I closed out and touched on with my story is that while we're talking about this, at the conclusion of that phone call, I did proceed with an egg freezing cycle. And my thought then at 22 was, if I have any chance of getting pregnant in the future, at least I can capitalize on the health of my eggs now at 22 rather than 30, 30 something, 40s, whatever it may look like in the future. And something that was actually really neat, and part of what really launched me also further into naturopathic medicine, is 3 months prior to that egg freezing cycle, I worked with a naturopathic doctor and I did acupuncture almost 3 times to 4 times a week for 3 months.
Wow.
I was on Chinese medicine herbs to help with ovarian failure. I did IV therapy. We did low-level laser therapy over the ovaries. Some research that was done in Europe and the UK that showed that could help stimulate the ovaries again. So I did a whole prep process. And at that time, I didn't think much of it. I was just looking for help in some direction and came across her clinic. And now looking back, I'm like, that was amazing that I went through all of that. And now that's kind of like what I get to preach now.
Yeah.
And so in that egg freezing cycle, once I went through with it, I was on really high doses of the medication. I was certainly bordering the potential of ovarian hyperstimulation, which can be really risky because it can cause ovarian torsion and then loss of those ovaries. But I didn't, thankfully. I was only successfully able to retrieve and freeze 4 eggs. So I have 4 beautiful little eggs on ice back home in Canada. And I know we've talked about this a little bit, but the logical part of my brain recognizes they likely won't serve a purpose from a fertility perspective. But I think going through that process when I did was so healing for me of like, I'm taking action. I don't have the answers. I don't know why this is happening. You go through like the why me things as you're processing those difficult times. But I felt like I was doing something about it. And I feel fortunate that my parents were able to help, me do that process, because financially on my own, I wouldn't have been able to. Yes, certainly not. And so I'm grateful for that. But again, the logical side of my brain was like, did it do anything? I don't know. But I think it healed at least a small part of me during that time frame. And again, I know not many will survive the thaw. Not many may actually be embryos.
When you freeze, it can be, and I've frozen, I have frozen embryos.
Right.
But I went through the process as well, as you know. But when you freeze, you get a certain amount of eggs,
right,
which varies based on age.
And how many did you get again?
I got 28 or 29, which is great.
Yeah, that's a good retrieval.
And then I ended up with 6 embryos.
Right, but like such a big difference.
Huge difference. Huge difference. So why does that happen? Like some don't survive the thaw, some are not viable.
Yes, all of those. So some like genetically just didn't look great, weren't as healthy as they were wanting. And then when they thaw, they just don't make it. When embryos are made, it's not a genetically compatible embryo. And then when we do get a good embryo, it doesn't implant properly. Like there's so many pieces to that puzzle, which is why we want such a large amount to start with. And so it was really abnormal for me to be 22, go through this process on such a as high as they could safely put me, dose of these medications. And I know that they actually retrieved 7, but only 4 were at the appropriate stage to thaw. And again, they would normally expect to at least get 30 or somewhere in the 30s, especially being in my 20s. So that was kind of like another, I actually remember that call. So my mom came into town, which was amazing just to be there to support me. And it was shortly after getting back from the retrieval. It was just lightly sedated. Were you also lightly sedated? So you're kind of like awake. You can feel the discomfort, which it's not comfortable.
Not
the
best.
Piercing of the vaginal wall and chitter chatter, but we've gone through it. And I do share that experience when it's appropriate with patients. But anywho, I remember getting that call and they were like, so we could only get 4. Do you want to try again? And I was like, I'm still processing this initial timepiece. I felt like I did as much as I could.
And it's incredibly expensive.
So expensive and just a lot on the body to go through. And so I was like, you know what? No, I think I did what I could. And I'm just hopeful that now at this phase in life, things will be on my side and that I put some good karma out there that potentially will conceive naturally. I won't and don't accept the infertile diagnosis. I don't feel that to be true. And I know you did this as well, but like mindset and meditation has been really important to me, of just like telling myself I have the ability to conceive and to carry and to have a healthy pregnancy. And I've just been like playing that in my mind. And now I'm blissfully optimistic of my journey. But it feels so good to say that and to be on that side, because I was so skeptical before. I was so ashamed of what I had gone through. I didn't want to tell anyone about the egg freezing. Very few people know, because it was kind of taboo. Like, why would you do that? It's shameful. Why do you know you're infertile? No one even knew I was trying to donate. Like, there were so many pieces of it, and this just like weighing on my shoulders. And it feels so good to now be on this side and to be able to share, not just with you, but with hopefully as many people that will listen. Because I think we need to be having these conversations more. And I think you need to know that healthcare providers are also going through this. And I feel my patients in the room so much more than I can even tell them sometimes, because it's not my space to share. But when they're telling me, you know, what they've gone through, the news that they've received, and my heart is beating, and I find myself fighting back tears in those moments with them, because I just like, I feel the weight of that, because I've been carrying that for like almost a decade now. It's been so much to process and to go through. And it just feels good to say it out loud. Oh my goodness, I think we need to be doing this more as women. We need to be lifting each other up. We need to have a space like this that's safe to share, because it's not taboo, and we aren't alone, and there are answers. And like I said, I know I've been frustrated. I haven't found my answer, but I'm at peace with the fact that I may not. But I'm at peace with the fact that what I've done with that curiosity is it's driven my career into like, I don't know it for me, but you better damn know I will do everything in my freaking power to find it for my patients. And I've been fortunately successful in doing so far. And I just like carry that passion with me, and that fire of like, maybe I don't know, but they will.
And that's the most incredible thing. And that's why I wanted to do this with you, to share your story, your journey. We're recording this in real time as you go through this fertility journey, which is incredible. But to create the space for other women and share that whatever the diagnosis is, whatever you think, even if you don't have the answers, you still have hope.
Absolutely. Absolutely. And there are providers out there that do want to help find those answers. You don't just have to be another number, another statistic. Like, know that a lot of the times there is something underlying. This has been a lot for me emotionally, but in a good way, honestly. It's been so much just baggage that I felt like I've carried, and that I really don't and didn't need to. And I can see you getting emotional. It's not helping me not get
Well, you're like my rock, and so it's like rare to see you like that, and really beautiful that you're sharing that, because so many people, so many women in both of our lives have struggled in this area, and it needs to be talked about.
Yeah. Well, thank you for being who you are, because you felt like a safe space for me to share my story with you, and probably in a setting you didn't expect, when we were like in New York just enjoying a nice dinner. But I feel ready to open up this dialogue and be part of the reason that it changes for other women in the future. And I'm so excited that like we get to kind of be at the forefront of doing that together, because you're a beautiful example of like how things can work out, which is amazing. And we also can be here to hold space for the women that have had the hell of the journey that it can be, and know that we hear you. We want to hear from you. We're excited to hear your questions. Please leave them for us, because we want to hold that space if they haven't had that, and maybe provide some direction or answers if they haven't had that either. So I love you. I'm so grateful for you in my life, truly. And I am so excited to move on to our next episode, and we can share with everyone all of the things maybe not to do.
All the things that I did.
Pregnancy.
Yeah.
Even with a doctor on speed dial, the ways in which we can beautifully and blissfully make mistakes and learn from it, but that we're also okay in doing so because we're human and we're perfectly imperfect and it's beautiful. So I'm excited to shift to your journey and help guide people through the mayhem that is pregnancy.
I love you. Thank you for sharing this.
Thank you.